Today I wanted to go over a trauma case that we had in the ER here. This was a patient that was moving at high velocities within a car, and the car struck a tree. The patient was then ejected from the car and was brought to UC Davis via helicopter. So I want you to focus your attention on the aorta here. As I come down, the aorta is bifurcating. It's bifurcating into the left and right common iliac arteries. Now focus your attention on the left common iliac artery. As I keep scrolling, there's a filling defect right here within the left common iliac artery. I'll keep scrolling some more and you'll see that eventually that left common iliac artery gives rise to the left external iliac and left internal iliac arteries, which then separate. So the left internal iliac artery is coming here posteriorly, left external iliac artery is moving anteriorly. We'll come back up. So let's focus our attention on the main finding here, which is this filling defect within the left common iliac artery. So this is an example of intraluminal thrombus in the setting of intimal injury, like a small confined laceration involving this vessel. So as I scroll down, you can see there's some intimal irregularity, and then there's resultant intraluminal thrombus here as a result of that injury. As we keep scrolling down, there's another finding I want to draw your attention to. So this is the left external iliac artery, and as I keep scrolling, you'll notice that the left external iliac artery, which I said was right here, is going to bifurcate here. It's going to give off the left superficial femoral artery and left deep femoral artery. So the left deep femoral artery is right here. It's giving branches that are supplying the thigh musculature here. This is the left superficial femoral artery. And notice if I were to compare the left superficial femoral artery with the right superficial femoral artery, there is soft tissue density or periarterial stranding around the proximal superficial femoral artery. This is concerning for hematoma. We don't see any active extravasation or active bleeding, which would be signified by having contrast coming out of this vessel and kind of messily spilling out into the surrounding tissues. But if you do compare this superficial femoral artery on the left with that on the right, you'll notice that there is a surrounding hematoma. Just as an aside, as I scroll up, some of you may have already seen it, but there's also a soft tissue contusion right here, which is just a soft tissue injury here. And you know, the normal subcutaneous fat looks like this, but here there's a contusion. So again, to summarize, this patient was ejected from the car and suffered traumatic injury here to the left common iliac artery.